Hello guys, today I'm going to talk about Down syndrome and I'll try to break it down as simple as possible. Down syndrome refers to a chromosome or an extra copy of a chromosome, the number 21. So when we say syndrome, we refer to syndrome as a group of events or diseases or features that occur together. So Down syndrome refers to an extra copy of the chromosome number 21. And it's basically characterized by genetic, physical, mental, developmental changes. We know that Down syndrome may be either more severe or less severe depending on the individual. So why it is necessary for me to discuss it or for us to discuss this is because the more you understand it, the better it is to prepare, prevent, or manage the conditions that come with it. So the symptoms are quite numerous and they may vary. So you have people that will have flattened face with broad nose or flattened nasal bridge, may have smaller head, microcephaly, may have short neck. Their ears may be low set. That is when you look at the level of the eye, the distance, when you draw a line to the ear may be lower. The mouth may be smaller. The chin may be receding. So it looks as if the tongue is bigger. So most of the time you have them sticking out their tongue. The eyelids may be slanting, maybe upward, maybe slanting. And you may notice that the upper eyelid has extra skin that is covering the corners, like folds of skin that is covering the corners. I said the ears are low set. The ears may also be smaller than normal, proportionate to the face. When you look at their hands, instead of having multiple crease, they may have just one palmar crease. That is, all these many lines that you're having for the palm readers, they may have just one prominent one. Even the fingers may be short, look stubby and short. The feet also, you notice that there's a gap between the first toe and the other toes, that there's a significant gap between the first toes and the other toes. Feet may be smaller, so they have small feet. As children, they have poor muscle tone, so they seem to be floppy, lax. Muscle doesn't seem to control the body well, so you have problems with sitting up, have problem with neck control as a baby, you have problem with walking on time, you have problem with doing some normal tasks that will be proportionate to the age, from 3 months, 6 months, like that. You have mental retardation, so they have the cognitive capabilities impaired, so they may not catch up as others in school. They may not move around the way or sports like growing children will move around. They may be shorter in height than their average height for their age group. You notice that their joints don't seem to control. They have lax joints. For the causes, just as I said before, there's an extra copy of the chromosome number 21. So we usually call it trisomy, trisomy, that is a third chromosome instead of two. Instead of a pair, there's a third one. And this is usually the main cause. Now, what can bring about this cause? We talk about people that have babies in old age. So from 35 years upwards, the risk increases. We talk about people that have had one baby that had Down syndrome before. Risk is higher in them. We talk about people that have probably inherited the gene for that triplicate of that chromosome. So they may come down with babies or come down with Down syndrome themselves. Why I want to draw an attention to it is that there can be some complications. So heart conditions, problems with digestion, problems with formation of organs in the body, especially for a growing child, can be a challenge. And of course, I've mentioned the mental retardation, but the cognitive impairment, not getting up to speed in class, in school. That can also be a complication and it's a challenge. Let's now talk about the social factors now. This child is now grown up to be self-aware, the stigma, the societal attention that the child is drawing. This child may have spinal problems. Spine may not close properly. The covering of the neural tube where the spine forms may not close properly. They will have things like spina bifida. They may have problems with obesity. Many of the times they are overweight. Sometimes they may have problems with their immunity, so they easily fall, so they are easily susceptible. They are susceptible to common diseases. So it may be a problem of immunity or immune system development also. They have higher chance, especially the young children, of having what we call a blood cancer called leukemia. And for those that grow up into adulthood, in their old age, they have a higher chance of having Alzheimer's. So I've talked about Alzheimer's, dementia, memory loss, cognitive impairment, and everything like that. Less common complications, they may grow up to have thyroid problems, they may grow up to have ADHD, anxiety, depression, they may grow up to have seizures, dental problems, ear infection, repeated or frequent ear infections. Those are less common, but we notice it in children or people that have Down syndrome because, of course, of the way the organs develop and the way they position. We don't have visual problems. So we have to talk about the life expectancy. On an average, especially with the recent technology now, we notice that they make it up to 60 years averagely and above. So they do well with management, live above 60 years. Now that we've reached this point, somebody will want to ask me, how do you prevent Down syndrome? There's no way to prevent it. What you need to do is watch out for the risk factors. Have your babies before 35. If you've had one before, be on the alert. Detection usually by genetic testing, pre-delivery, preconception testing. So while the child is in the womb, they do amniocentesis, that is, they take a sample of the amniotic fluid and test it. They check for genetic materials. We can also take a sample of the chorionic villi, part of the placenta, basically. They can do blood tests prenatal before this child is born. There are so many tests, but also you have to consider the complications of doing these tests on an unborn child while the child is still developing. So we talk about the need for a genetic counselor to let these parents know, okay, this is what we are looking for, this is what we're finding out. And that's back and forth, we're going, asking questions and telling you what is going on. And then you decide. You can test in the first trimester, you can test in the second trimester, you can test in the third trimester. There's also what we call the nuchal lucency test, but that's beyond the scope. There are tests that you can do. And when this child is born and you discover this child has Down syndrome, the mother, that is the immediate family, the child needs support. Identifying where the challenges will come from and making buffers ready for those challenges. Identifying the support that the mother will need or the father will need. And giving the right support when there's needed. Eye tests, ear tests, checking the throat, checking the intestine, checking the spine, checking the nervous system, doing blood tests to find out presence of leukemia and all the other things. Helping this child in a special class when it comes to development in the class, learning capability. And I hope I've broken it down. There are also people, they lead normal lives, and I've seen quite a number of people that are quite pleasant. I'll see you guys on the next one. Bye-bye.